due date. Such an important term during pregnancy, right? We keep hearing it again and again, especially towards the end of pregnancy. So in this video, let us discuss what is the due date, how do you calculate your due date, and the importance of not looking at only the due date during pregnancy and birth. Hi, I'm Saranya, a birth professional, the founder of Babypedia, and a life coach for mothers. So let us quickly look into what is the due date. So as soon as you get the positive pregnancy test and you go for your first scan, your doctor will calculate something called the estimated due date or the EDD. So this date is supposedly the day on which you may deliver your baby. Or this is also called the length of your gestation or your pregnancy period. Okay, so why did we say estimated due date? It is because it is only an approximate and it is not the final day in which your baby has to come out. Okay, so how do you calculate your due date? There are two different ways in which you can calculate your due date. So the first one is adding 40 weeks to the first day of your last menstrual cycle. So for example, let's say you got your periods last on March 1st. Then what we are going to do is we're going to add 40 weeks to March 1st, and the day in which the 40 weeks end, that is your estimated due date. The second method is a little more easier. So what we're going to do is count backwards. So we're going to minus 3 months from when you got your periods. So if you got it on March 1st, let's say you're going back 3 months. So that's February, January, and December. So your date will be November 30th. Now to that add 7 days. So December 7th. Okay, so you're going back 3 months and adding 7 days to the date that comes. That will be your estimated due date. So December 7th is your estimated due date. Okay. Now let's look at the importance of knowing this particular date. So what we have to understand is only when we find out what the estimated due date is, it actually helps us to calculate which month you are in and which week you are in. And based on that, your scan and everything will be done. Okay. Now, along with this, in your first scan, especially, at the 6 to 8 week scan where doctor hears your baby's heart rate and tells you whether your pregnancy is healthy or not. And then the 12th week scan, which is called the nuchal translucency scan. In this, your doctor would have recorded the due date based on your baby's growth. Okay, so generally, the due date that is seen in scans, in the earlier scans of pregnancy, tend to be a little bit more accurate than any other method. Now coming back to how do why is it important? So now we have to understand that a human gestation period, that is a period of pregnancy, is anywhere from 38 to 42 weeks. Okay. So on an average, we find that this center point, that is the end of the 40th week, is where we can say, give an approximation of when your baby will be born. That does not mean that your baby has to be born on the due date. Your baby can be born anywhere 2 weeks before or 2 weeks after your due date. Let me tell you why. Because this due date is calculated on the assumption that almost all women have a 28 to 30 day menstrual cycle, and we ovulate anywhere in the center, that's the 12th to 15th day. So usually what happens, your egg after ovulation is viable only for 24 hours. So fertilization has to take place within that time. So we are assuming that you became pregnant between the 12th to 15th day of your menstrual cycle. And so from that, when we calculate 38 weeks for your baby to grow, then the end of the 40th week is the right date. But practically, when we look at it, not all women have a 28 to 30 day cycle, menstrual cycle. We may have something that's shorter like 25 days. We may have longer cycles like 45 days. And even if you have a 28 to 30 day cycle, ovulation does not necessarily happen only between the 12th to 15th day. Sometimes we may ovulate earlier in the cycle, or we may ovulate later, a few days before we get our periods. So ovulation also cannot be 100% sure. So what if you ovulated earlier in the cycle and you became pregnant? Or you ovulated later in the cycle and you became pregnant? Then your baby may be ready to be born a few days before your due date, or will need some more time. So your baby will be born a few days after your due date. So given that your pregnancy is low risk and around the time of giving birth, your health is okay, your baby's health is fine, then your doctor may allow you to, wait for some more days and then go into labor naturally. But if there is some sort of medical complication or indication, then your doctor may recommend that you give birth earlier than that. Okay. So based on your health towards the end, your doctor will tell you. So always remember that it is estimated due date and it is not the evacuation date where your child has to be born within that day. So don't give heed to well-meaning relatives or friends who keep calling you and saying your due date is approaching. Have you given birth? Don't get stressed. This is just an indicator. Trust your body, let your baby get fully formed, be ready to be born, and then usually birth is easier and better when labor pain kickstarts on its own. So let's wait. Happy pregnancy. Take care. I will see you soon in another interesting video just like this one. Don't forget to follow the Babypedia channel to get more information on trying to conceive, pregnancy, early parenting, breastfeeding, birth, and much more. Take care. This is Saranya.